Good evening and welcome to session 15. Before we start, the official disclaimer. Yes, images displayed during this medical training session, they are for educational purpose only, and not all images. Definitely not all images, because some images they'll be like as if we have picked up them from horror films, right? So they are not suitable for audience of all ages. Okay, so let's start with our today's session, and that's the cranial nerves. We'll be dealing with first six cranial nerve, 1, 2, 3, 4, 5, 6. Now when we study these cranial nerves, say even by the end of today's session, you'll feel that what a beautiful craftsmanship it's of the God, and how in depth all the cranial nerves they are designed in such a beautiful way, right? And say so we'll be doing some merciless dissections. Our idea would be that every nerve should be traced right from its origin till its end with all the branches. Simple. That's what we are going to do. So we'll be entering into the orbit so many times. Mandible to is gonna curse us because we'll be shattering it into so many pieces so that we can watch even all small nerves. And yes, in and out at times we'll go into the skull, we'll go into the cranial cavity, we'll come out, we'll go into the neck, and that's how we'll follow all the all the nerves and their branches. As per our standard protocol, whenever we'll write something like this, say for example 2 and cut. So this one means that we are sacrificing optic nerve for that point of time so that we can see other structures, right? So welcome to a super marathon session of cranial nerves, right? And today we'll be dealing with 1, 2, 3, 4, 5, and 6, right? These are the 6 cranial nerves which we'll be dealing with. Now, how are these numbers? Say when we say that, okay, this is olfactory, right? This is optic, then say oculomotor, say trochlear, and this one, she'll be our guest of honor, trigeminal now, right? And finally, the sixth one, abduction. Now, these cranial nerves, they are order, right? Their order is given, numbers are given, the order in which they leave cranial cavity, right? So, the order in which they leave cranial cavity, right? So, that's how they are numbered. So, there is nothing like that. Sensory ones are first, then motor. No, nothing like it's all mixed, right? So over here, this is, you know it so well, smell. This is for our vision, right? This oculomotor, trochlear, and abduction, they are pure motor because they'll be handling those muscles, right? And for that, we always say, just remember SO4 and LR6, right? More as we approach. And then regarding trigeminal, we need to change the color, right? Because this nerve is so beautiful. So many things, so many things, right? So that more than 50-60% of our entire discussion will be revolving around trigeminal only, right? So this is the largest, and it's a mix now. So we'll actually see that which are the motor fibers, right? Which are the motor branches and which are the sensory branches, and we'll trace them actually till their root, right? So that's what it is on our menu today, and let's start. So we start with number 1, olfactory, right? A small one, right? Really a small. This one is what? Olfactory tract, right? This is olfactory tract. It ends in what? It ends in the bulb. So that's where the olfactory bulb is there. And then there is cribriform plate. But what's the fun if we make it so simple? Let's see it in more detail. Now here it is, right? So this is what we are going to do. We'll see sometimes the dry skull, then we see the skull with the dura so that we can coordinate with those openings. Then we'll do the real dissection so that we can see the real fibers, real nerves, and that's how we shall proceed. So this is world famous crista gili, right? Crista gili, and both the sides there are ethmoid plates, correct? Those ethmoidal cribriform. Cribriform means sieve-like in which there are holes, right? Cribriform plate. And through these holes, right, because bulb will, this is the house of the bulb. So bulb would be over here. So through that bulb, those fibers, they'll be entering into the nasal cavity. All right, let's see something further. And as I said, so here it is. This is a super dry skull, absolutely dry. So, and we have taken the section through cribriform plate. Why? Here is the cribriform plate. This is like not doubting your intelligence, but it is like we'll be doing it from so many angles, right? We'll be those taking sections from so many angles so that picture becomes clear. Literally in 3D perspective, you should be crystal clear with that. Okay, what is pterygomaxillary fissure? How it goes into that inferior orbital fissure? Where is that maxillary foramen? Where is that mandibular? Where is that rotundum? Everything should be crystal clear. So that's why we'll be looking it from various perspectives. Here we have taken a section, and this is the location of those cribriform plate, right? The important is that, see, the roof, right? That is the roof, right? So this is a narrow roof of the nasal cavity, right? This is the narrow roof of the nasal cavity, and that's the location of cribriform plate. Okay, how interesting would it be? Now this is like in this specimen, where is cribriform? Here is the cribriform. This is the area. That's the area, right? Because then starts this entire sella turcica, dorsum sella, right? Base occiput, and then below is the sphenoid sinus. This is the pituitary fossa, right? We'll come to all those things, but this one is cribriform plate. Fine. Let's go still deeper. Here it is. This is a super zoomed version, right? A tight close-up. And it is in this close-up we see that, okay, that's the cribriform. And through that, these are the olfactory fibers, right? All those fibers, that's what they are landing. And these are the filaments, right? Olfactory filaments, they are in mucous membrane, right? They are in mucous membrane. So this is how there is a short journey of olfactory. And what really happens is that it is this area, right? That's the area. That's the area. That is what is also called as the olfactory area, right? That is the olfactory area. That's where those rich load of all those filaments, they are residing. Fine. So this was short and sweet of olfactory. Moving on to cranial nerve number 2. Now this is optic or vision. Our yesterday's journey was telling that this is optic tract, right? Optic tract. And these optic tract, they combine together, and then once again they lead to formation of this. So this is the area. This is the area where they merge, right? And that's what is called as the optic chiasm, right? That is optic chiasm. And from that, there would be optic nerve, right? So that's the beginning of this optic nerve. Number two. Okay, let's see this thing in when the dura is intact. So here it is, right? Everything same, but this is the optic nerve. So I will just write 2 over here. So 2 is our this optic nerve and it goes into the dura. It goes beneath the dura. When it is going underneath the dura, so that is beneath or underneath the dura, it is going for, it enters into, it enters into a special canal and its name itself is optic canal, right? That's optic canal. So that's where it enters. Well, if it is that, so let's see the optic canal. And here it is. Yes, now it makes sense, right? So this is what, this is anterior clinoid process, correct? Anterior clinoid process. This is the royal seat where, oh, I actually wrote royal, doesn't matter, right? Where actually the pituitary gland would be Virajman, right? That's the posterior clinoid process, but the canal in which we are interested, optic canal, that's the optic canal, right? So in dry bone, it is the anterior clinoid process which is giving us the reference, and that's where the optic canal is. Okay. Now adding something. Video is lagging. Really? It should not as such though. Still, if it's lagging, just let me know. Otherwise, it should not, because over here the bandwidth it is showing quite okay. Anyway, let me know. Yeah. So what I was talking about, that say if we lift this optic chiasm, right? Lifting optic chiasm. So just underneath it, you see two things. One, this one. They are internal carotid artery. Okay. Internal carotid artery. Right? No doubt, divided. We have cut it, right? But this is just for the preparation. So that next time, that is after completion of cranial nerves, when we'll be talking about the blood vessels. So at that point, I'll tell you that you remember this, right? So this is the divided internal carotid artery. This one and this one, right? They are there. And this is what we just talked about, that royal seat, right? So that is the roof of pituitary fossa, right? And in that pituitary fossa, you remember that pituitary fossa was like this, right? And then there was a hole which was created by dura, and through that dura, what was passing? That infundibulum or the stalk, right? So that stalk over here, because we are right now not discussing pituitary, so we have mercilessly cut it. That cut infundibulum is this, right? So that is the cut or divided infundibulum. Fundibulum. So underneath there is the entire pituitary fossa. So that's why we'll call this thing as roof of pituitary fossa. Few of the words, they are important, right? Pituitary fossa. They are important because they'll be giving you the proper picture, right? So when we say roof of the pituitary fossa, or when we say floor of the orbit or the roof of the orbit, so and today there'll be lots and lots of such things will be coming. At times, it would happen that you might have to watch the image like this, right? Tilting your head, right? and actually it would come. Okay, so here it is. So this is fine. Let's move further, and here it is. What's this? Every time first I'll orient you. Yeah, this is that internationally famous Crista Gali, right? Crista Gali. right? So immediately what we are talking about, this is anterior cranial fossa. Yeah, very good. This is anterior cranial fossa. So this anterior cranial fossa, if we just cut it, where exactly will enter? Well, straight away we'll be landing into orbit, correct? We'll be landing into orbit. So we need to do that, right? So what we do is we just chip off the roof of the orbit, right? Or the floor of anterior cranial fossa. It's one and the same thing, right? So we just cut that bony layer. So only, to be precise, roof of orbit that has been removed. We see some nerves, we see some fat, we see some muscles. Where are they? Say these are nerves, right? Right now we'll not be worrying about that which nerve is this. But by the end of today's session, you'll be knowing every nerve, every muscle, everything, right? So don't worry. But what we see, our first impression that this is what, this is some fat, okay? It is in orbit, so we'll call it an easy name, orbital fat. All right. And these are typical color. These are muscles, right? These are muscles in orbit, so they are orbital muscles. Orient. See, this is right now we are into the skull, right? We are into. So this is optic chiasma. Let me change the color. This is optic chiasma, and from here there starts the optic nerve, right? So we are inside the skull, top view, right? So here is the skull, right? The bird's view, top view, drone's view, and that's where, right? This is the region where we are dealing with, and we have removed the top portion, right? That is the roof of the orbit or anterior cranial fossa floor that we have removed. Just that thin piece of bone, so that now we are watching the orbit. Got it? Yeah. So this is orbit, in which we see immediately nerves, orbital fat, and the muscles, right? At this point of time, we really don't need these nerves because our purpose is to watch for our favorite optic nerve. So let's remove these nerves. Let's remove this orbital fat, right? Not foramen, orbital fat. Even we'll be sacrificing those muscles also, but let's do it systematically, step by step. So here we remove it. So now we see that yes, they are seen quite properly, right? These are muscles, and now we know that it's not one muscle. There is one muscle, there is second muscle. See, there is one more muscle over here. So smart, right? See, there is one more muscle over here. There is one more muscle just underneath. Oh, so that means there are so many muscles. We'll see all these muscles later. Right now, right, we'll sacrifice them, right? Done. So all those muscles are cut. Now I think you are oriented properly, everyone. In case if there is problem, just let me know, because this is very important. As such, it is easy. Just the bird's view, right? Here it is, right? That's like anterior cranial fossa, and this is where we are, right? Because it goes into the orbit. And here it is the optic nerve, right? Optic nerve. This optic nerve, if I draw it like this, it goes at an angle. At this angle it goes, right? It goes like this. So right now we are dealing with the right side, because we are watching it from the top. So this is what we are watching. Now if you watch carefully, there is one muscle over here, there is one muscle over here. So actually it passes between those tendon of two rectus muscle. Rectus means straight. So in case of orbit, right, there are four rectus muscle, four rectus. So superior, inferior, medial, lateral. Such an easy name, right? So superior rectus, medial rectus, lateral rectus, inferior rectus. Two oblique, right? Superior oblique, inferior oblique. And then one levator palpebrae superioris, right, for the eyelid. That's it. So over here, which side is medial? Well, this is cribriform plate. So this is medial side, right? This is medial side. If that is medial side, this means this muscle, which is straight muscle, this one would be the medial rectus and this one would be the lateral rectus. As such, we are going to see these muscles in more detail, right? So medial rectus, lateral rectus, and in between, there is royal entry of this optic nerve at an angle, right? At an angle. Now it is actually like a royal entry because optic nerve is the only nerve which is not a nerve, right? How funny. It is not a nerve. It is in fact extension of brain, right? It is extension of brain. Now how can we say that? It is because brain has got dura mater, arachnoid matter, pia mater. Same way, optic nerve has got all the layers. All the three meninges, they are present in case of optic nerve, right? We need to see it to believe it, right? So here it is. Here it is. In this, what we have done is, we have created a window in dura mater, right? So only the layer of the dura has been cut above and below. So that's like an edge. This is like an edge, right? Edge of dura. Edge of dura. And inside, what we are watching is the optic nerve, right? Surrounding, there is dura mater. But it was not only dura, right? The next one was what? That arachnoid matter, right? And that arachnoid was nothing like a thin transparent layer, very thin transparent layer. So it has to be present. Let's see, right? Here it is. Now we are convinced that's arachnoid. That's arachnoid, right? So now it is fine that it is the dura mater and the pia mater. So it cannot be separated, right? It is almost merged with the tissue itself, right? And what happens to this dura mater as it goes towards the eyeball? Now this dura, it is continuous with the outer layer of eyeball, right? Outer layer of eyeball, sclera, right? So this outer layer of eyeball, right? So this is continuous with, right? With outer layer. So that's how this entire process goes. So this is where the optic nerve takes care of. Now, say this is a very fine, super nice selfie of this optic chiasma because it is telling us that this is what I shall be doing. The lateral fibers, they will not be crossed, and the medial fibers, they will definitely be crossed, right? Just to remember this, that medial fibers, right? Medial fibers cross and laterals not. Right? This will help us when we'll be discussing the physiology. Okay. So that was the second cranial nerve, right? Now we'll take together 3, 4, and 6. Right? We'll study these nerves together, not to save time, but because all of them, their destination is same, right? Their final destination is same for all of them. No doubt, once they'll reach the orbit, right, they'll do their respectively given work. So this 3 is what? Oculomotor, right? Oculomotor. 4 is trochlear. And 6th is abducent. All right. And we said that there were 7 muscles, 4 rectus, 2 oblique, 1 levator palpebrae superioris. So it is so easy to figure out that where exactly they will be going because all of them, they are motor. That means their work is only one, go and supply to some muscle. Because brain will be telling, depending upon the situation, that turn your eyes on this side or that side, right? So boys, they know this thing very well, right? So all these things, they come from brain. Unnecessary, right? They tell you that why it is happening. But it is like the brain which is capturing the information. And these are the muscles which will be working. Yes, yes, yes. Right now, because why I'm not going for the visual pathway, because there is so much in visual pathway. There is so much, right? We'll need a nice session to understand the entire visual pathway. So that's why I'm not discussing that how the images are inverted, how exactly those images they are stored. Even the Pape's circuit also that comes into picture. Even the emotions they come into picture, right? So many amazing things they are there. But we'll have one session on that, where after learning the entire brain, after learning all the nerves and their pathways and everything, right, we'll have that one session, that when we say that if someone tells you hello, and then what really happens into your brain, what really happens when the smile comes, what really happens when the message goes over, then they can chalo yaar usne hello bola, you also say hello, and that's how the entire process starts, right? It is such a beautiful mechanism, because in that every part of the brain it starts getting involved. It is one of the finest computers, right? All those computers like Deep Blue, etc., they are absolutely nothing in compared to your brain, right? Your brain is that superlative. Oh yes. So here it is oculomotor, right? So oculomotor supplies what? Who remembers, right? Trochlear 4, so this is SO4, and this is abduction 6, so this is LR6. Okay, rest of the muscles they are by oculomotor, right? So we'll very smartly we'll say that okay, superior oblique, so this is inferior oblique, right? Then superior rectus, yes, inferior rectus, chalo done, medial rectus, lateral rectus, done, all thing, and then finally levator palpebrae superioris, done, right? So that's how we do it, right? Okay, so these are the muscles which will be supplied because it is a motor one. Yesterday, when we were identifying these cranial nerves, I said that every time we'll be talking about some keywords, that from where they are emerging. When it is said that number three, oculomotor, it should it should jump in your mind. Yes, oculomotor is here because oculomotor, it is between cerebral peduncles. Simple. Cerebral peduncles. Big cerebral peduncles, right? Between two cerebral peduncles, these oculomotors, they come, right? So that's oculomotor, right? That's number three. And remember the keywords between cerebral peduncles. In case if there is any doubt, right? Peduncles. Yesterday we discussed these cerebral peduncles at length, right? With all sections, removing that cerebrum and everything. Okay, so these are like this one and this one, right? Very nicely seen. These are our oculomotor. Okay, what about the next one is trochlear, right? For trochlear again, right? We said that this is a super delicate, very slim, thin nerve, and that is which is going from the back of the midbrain, right? Here it is. See, such a hidden nerve, right? This, see, that's now see, right? This one, right? This one. So that's trochlear. This is posterior view, right? So this is the back, right? This is posterior or the dorsal or the back of the brain, right? Of the back, right? So this is midbrain, right? So we said that trochlear number 4, right? It arises from back of the midbrain, right? So that's the keyword, from back of the midbrain. Okay. And number 6, right? Number 6 was abducent. And for that, we said that, okay, it is very easy, right? It is very easy. Midbrain, pons, medulla. Between pons and medulla, there is a groove and it will be emerging into that groove. Here it is. Here it is because this is pons. This is medulla oblongata and it is the groove. So that is number 6, abducent, right? Abducent. Number 6. This is between that groove. Not it is. Abducent is in groove between pons and MO, medulla oblongata. Right? Okay. Now let's see these things in with more clarity. Okay. This is what this is superior orbital fissure, right? This is superior orbital fissure. This superior orbital fissure is going to get tremendous importance today because see, number 3, number 4, number 6, they'll be passing through it. Not only that, even the trigeminal, the ophthalmic division, that would also be coming over here. But right now we'll keep it up, keep that nerve apart. Say this 3, 4, and 6, right? They will be coming over here. This is superior orbital fissure. This is the reason that every time we'll be discussing this nerve, it means we have to go and check into the orbit that what exactly that nerve is doing. So we'll keep on exploring orbit again and again and again, right? So that's how we'll be doing multiple time revisions so that every muscle, every nerve over there, that is crystal clear. Let's go further. Now this is the best image. Why? This is in real life. In real life, as we said, that those foramen which are the into the dry skull, right? They never match with in real life because there is dura matter. So foramens they change because all the nerves, all the vessels, they travel into dura for some time and then they dip into their original foramen, right? So here it is, this one, right? This one, that is number 3, oculomotor, oculomotor, right? Orient yourself first, right? Just a minute. Orient yourself that where exactly. This is fine that we say that that is optic chiasma and everything. But here, the skull is slightly tilted, right? Slightly tilted. Got it? So how do we say it? See the angle of optic chiasma, right? So as if the whole skull is like this. It is at an angle because that's the optic chiasma. This is the optic nerve, right? So that's the angle, right? Purposefully we have done this. You'll understand the reason within a minute. Okay, right? So that's the angle. So here it is. So over here there would be superior orbital fissure, right? So right now it is covered. So we'll open it. So this one is number 3, that is oculomotor. Oculomotor between two peduncles, big now, can be seen easily. Yes, fine. Trochlear, always delicate, right? Because as such, it was to supply just one muscle, SO4, right? Superior oblique. Where is it? This thin, machar-like thin nerve, right? Right? We are not insulting this nerve, but because she's so slim, so thin, right? That is trochlear. That is trochlear. And then abducent, right? Very prominent. Here it is, right? That is number 6, abducent. So these are the 3 nerves. Now these 3 nerves, they should combine together so that they can go to superior orbital fissure, right? So right now we are watching intact dura. We need to cut this dura. Okay. So here it is. When we see that these nerves, right? So now we can see these nerves, right? This one this one, and this one, right? This is slightly unzoomed. Don't even look at this now, right? Because that's our chief guest. So don't even look at, right? So this is 3, this is 4, that is 6, and all of them, they should be going into this direction, right? So we need to remove this much dura. So let's cut that, right? So we say remove dura. Okay. And here it is, we remove it, right? The moment we remove this dura, right? Say this is the edge, right? That dura matter is removed. We see so many structures. Right? Better we zoom it, right? So here it is, we zoom this. Just keep this image into your permanent memory because this image is going to come again and again and again so many times. Right now, what it is really showing awesomely is our chief guest. This is trigeminal trunk. This dark portion, what you are watching, this is trigeminal ganglion, right? And this one, and this one, right? Ophthalmic, right? Ophthalmic, maxillary, and the mandibular, right? These are the 3 divisions which are going gracefully over there. But right now, no, this is like we don't want to watch her, right? We want to watch those nerves. So let's sacrifice them. Gone. The moment we remove this, right? The moment we remove this, there is this big khadda, right? What is this? This is the cavity. We have opened some cavity. Yes, this is a cavity. This is a cavity. And in real life, it is filled with venous blood. Friends, this is nothing but this is filled with venous blood. This is one of the very important structure, and that's what is called as the cavernous sinus, right? You remember sinuses. These are the venous sinus. Venous sinus means nothing but this is one layer of dura. This is another layer of dura, right? In between the blood is there, right? It is going. It is all venous blood, right? So that's how an entire brain, then there would be a beautiful circulation. But this is the place, right? That is what is called as the cavernous sinus, right? That's the cavernous sinus. And yes, it is filled with venous blood. All right. And we see something is going, right? Something is going, something is in the back. So what are those structures? So neatly, if we see there is one structure which is going like this. In fact, this structure, it takes turn, right? And then it goes like this. This is artery. And immediately you will say that yes, this could be only one, and that is internal carotid artery, right? We just saw that when we lift that optic chiasma, that was the internal carotid artery where it was going, but it is its further journey, right? So this is internal carotid artery. All the arteries or veins, if I'm picking up the name today, just to make you a bit familiar that okay, these are the areas where arteries, veins are there, so that our understanding of vascular system, that will become easier when we talk about this blood supply of the brain. Okay, right? So this is one, that is internal carotid artery. And but we are interested in what? We are interested in our nerve. So we still zoomed it, and here it is. Here it is. The thick, powerful oculomotor, right? A delicate, now it is not looking that delicate, right? It is quite good. So this is trochlear. And super strong abducent, right? So this is oculomotor, trochlear, and abducent, and all of them, they will be moving to superior orbital fissure, right? So this is where they are passing, moving further. So let's enter into now orbit, right? So again, what we have done, we have removed that roof, right? Roof of the orbit, right? So back to the orbit, and we have even removed some nerves also, right? Those nerves, if you remember those nerves, they were over there, right? When I'll tell you which nerves are there, you'll be so happy, right? But still they are yet to come. Okay, so this is the time when we know at least these muscles. So this first muscle, which is so powerful, looking so graceful, is levator palpebrae superioris, right? Impressive name. So levator palpebrae superioris. But we cut this muscle, right? We cut this muscle and we flip this, right? So that's our levator palpebrae superioris, which was cut and it is taken back. So here it is, it has been flipped. So another healthy muscle it is seen, right? Just on the top, absolutely straight. So he can be only superior rectus, correct? He is superior rectus. All right, we want to see further. So let's cut that muscle too. So we cut superior rectus. Here is superior rectus. So this is levator palpebrae superioris reflected. This is superior rectus reflected. And now we see the structures, right? This is, we have already talked about, that's the optic nerve, right? That's the optic nerve. Nothing new till this point, right? But let's separate some of the structures, let's clean them, and now so that we should be able to see more structures. Yes, now more muscles are seen. So this is levator palpebrae superioris. Fine. This one is superior rectus. That is also good, right? This is on the lateral side, so it has to be lateral rectus because there is nothing like lateral oblique, nothing like that. This one is medial rectus, right? Straight muscle, medial rectus. Then there is a top muscle over here. There is a pulley-like mechanism, and then it is taking a turn, right? It is going oblique. So there it has to be superior oblique. This is superior oblique. Fine. Now reorient yourself. This is how we are watching. We are watching from the top. Now we take the entire body 180-degree, right? So we were watching from the top, right? But still we'll be watching from the top, but the body is changed. So this is anterior, correct? This is anterior. Now this is anterior, right? And that's how, see how this optic nerve is entering. This is the eyeball, right? That's the eyeball. All good. So that's the anterior. This orientation is important because we really want to see that via that superior orbital fissure, when the nerves are coming, immediately they start dividing, right? So that's why we want to see those nerves as they emerge from the superior orbital fissure. Fine. Okay. So here it is, as they come, right, as they emerge out, what we see? We see this is like optic nerve, right? That's the optic nerve. Now optic nerve, we have seen enough of the optic nerve. We really want to see something more, right? And that is what is underneath. Because the first thing, say over here, can you see this one, right? A nerve which is going all the way up. This muscle was what? This is levator palpebrae superioris. This means there is some nerve who is supplying it. Which nerve would be supplying it? It would be oculomotor, right? So this is oculomotor, right? When we say oculomotor, so it has got two branches. One is the upper branch, right? So that means this one would be the upper branch because got it now. Say when levator palpebrae superior, so we are right now we have reflected as such, so it is on the top. So this is the upper branch. As soon as it appears from superior orbital fissure, oculomotor gives track one branch up to LPS, levator palpebrae superioris. Similarly, it will give a branch to this. This was superior rectus, correct? Both of these muscles, they are supplied by oculomotor upper branch. So levator palpebrae superioris and superior rectus by them. Very fine, right? And just for the orientation, this is which muscle? This one will be medial rectus because that is that world renowned crista gali, right? Crista gali. It reminds me of Chris Gales only. Okay, and this one, yesterday's match was very good, right? Just by 2 runs, they lost the game. Okay, so coming back. So here it is. Where is this lower branch? Right? Where is this lower branch? And for lower branch, we need to say bye to optic now. Right? We are now about to remove the entire optic now so that we see the floor. Right? We see the floor of orbit. So here is the optic now, right? And we'll cut that, right? So this is like medial rectus, that's the lateral rectus, right? So nicely they are seen, and we remove it. Done, gone, right? So this is the cut edge of that optic now. Immediately as we see the optic now, right, there was on the top there was superior rectus because actually if you watch from the back side, right, this is, so those four rectus, so they are situated like this. So this is superior rectus, this is medial rectus, this is lateral rectus, this is inferior rectus. So as soon as we remove that optic now, we should be watching one muscle, and this is inferior rectus, right? This one is medial rectus. This one is lateral rectus. Superior rectus was on the top. This was superior rectus. And on top of it, there was levator palpebrae superioris. Correct? So easy. है ना? We saw even superior oblique also, right? Over here, superior oblique. Inferior oblique is actually underneath. It is underneath the eyeball. We have to remove the entire eyeball to see that inferior oblique, because I'll just write IO is underneath the eyeball. All right. And in any case, when we'll be discussing orbit, we'll be watching that muscle definitely, right? Right now, our purpose is what? Back to that now, right? 3, 4, and 6 now, they are onto our target. So the lower branches are here. Here are the lower branches, right? See, so nicely going to all these muscles. So that is, these are the lower branch, that's a lower branch of number 3, oculomotor. Right? So easy. So upper branch and the lower branch. There are some small nerves. These are like short ciliary nerves. Now, what this ciliary nerve is doing, this is like a parasympathetic supply, right? Parasympathetic supply. So what happens to our pupils when there is parasympathetic activation? See, sympathetic is what it is for emergency. When there is emergency, when you have to attack on someone, when you have to fight on someone, right? You will dilate your pupils, right? So that more information comes in and you can plan the strategy. Parasympathetic is what? Relax, eat, and rest, right? So at that point, pupils, they are constricted, right? So it has to be constricted. So it leads to constriction of pupil. So why should it go for constriction of pupil? Well, because of two muscles, constriction of pupils. Just two muscles, right? One, it is what is called as the sphincter pupil. And second is ciliary muscles. So it is the joint operation of these two which leads to constriction of pupil. That is when the parasympathetic is activated, and this parasympathetic supply is given by short ciliary nerves, and these are the short ciliary nerves, right? Because once we'll complete all these 12, mostly if the time would permit on the same day, if not on the next day, we'll be discussing even the sympathetic plexus also, sympathetic chain also, right? To complete the entire picture. Okay, so that was the game of oculomotor. Moving on to the next one, and that is trochlear. Trochlear so is easiest. All we need to find out that where is superior oblique. Where is superior oblique, right? Say this is superior oblique, right? Because all the way it is giving that pulley over here. This is the medial rectus, correct? So this is superior oblique. This one was superior rectus. This one was lateral rectus. Underneath was inferior rectus. This was levator palpebrae superioris. So this muscle, this belly, right? Over here it is looking big because it has been separated properly just so that you can see it clearly. No, they are part of it. They are part of it. Right? We'll see that thing in more detail. Okay, so this is superior oblique, and here it is. Here it is. It has to be number 4, trochlear. Right? That's the trochlear. So this is good. And finally, the lateral rectus. Right? Since long we were telling about this lateral rectus. So the nerve which is going over there, it has to be this, and that is number 6. This is abducent. Right? So done. Right. Yeah. Back to original position. So once again we have rotated it. Right? Now you should be able to see this this oblique one very properly. Right? See, the oblique is seen. So we just put all the structures back because we'll be coming back to orbit once again, right? So this is that orbit, and we put all those fat, all those nerves, we put them back, and we now come to our trigeminal. So we talked about 1, 2, 3, 4, 6, right? This is the largest. And from where it arises from pons. So that's the key word. Here it is. You just can't miss it. It arises from pons, right? This is very important because this nerve, it's a mixed nerve. And when we say mixed nerve, it means why? Because we'll see that there will be several branches, right, which are sensory to face, okay, then nasal cavity, and that nasal cavity, that is so mesmerizing, such details, right? And the oral cavity, again, that is also that lingual when it goes, right? And regarding the motor, yes, it will be going for muscles, so that would be like muscles of mastication. We'll be watching all the branches, all the divisions. This trigeminal, it divides it into three parts, right? One is like ophthalmic. That is where we'll be visiting orbit again. Then maxillary and the mandibular. So it is like when it will come to maxillary, at that point we'll torture maxillary bone, and when it will be discussing mandibular division, we'll torture mandible, right? So that's how we'll proceed. Remember few keywords like those bones, right? And then there are three divisions, and it is a mixed now, right? You just can't miss it is this piece of information. So here it is, straight away we go for that. Where is our that fifth now? And we see that first thing first, that it is this area. It is this area, right? That is what is called as the trigeminal cave, right? It is called as the trigeminal cave. And this trigeminal cave is because it will be having trigeminal ganglion, right? And so thus it is like stem, then there is a ganglion, and then all those three divisions they'll be traveling. So we need to see it properly, right? And by the way, where is it? So from pons it goes, right? So that's where it goes. So here it is. This would be the area. This would be the area of that ganglion, right? Yeah. So that is trigeminal ganglion. And in order to see this, we need to once again remove the roof, right? But this time, this is what? This is middle cranial fossa, right? This is middle cranial fossa. So orient yourself, middle cranial fossa. And in this dark portion, right over here, this is ganglion, and this is 1, this is 2, that is 3, this is ophthalmic, this is maxillary, and this one is mandibular, right? That is how it will be going. So here we sacrificed some of the dura, right? Some of the dura, and here it is. This is like a zoomed version. So in this dark portion, that is ganglion, this is trunk, right? Ophthalmic. And see, now onwards we'll say ophthalmic as, right, maxillary as V2, and mandibular as, so this is 5-1, 5-2, 5-3, right? This is not V, this is number 5. So because it has got three divisions. So that's why at times when you say cranial this 1, that means we are dealing with the ophthalmic part, and similarly others. Yeah. So over here, right, this is pituitary fossa, right? That's pituitary fossa. And this one would be the middle cranial fossa, right? That's the petrous temporal, correct? So over here, that is superior orbital fissure. This one is foramen rotundum. This one is oval, right? So superior orbital fissure. That's the fissure where 3, 4, and 6 they were traveling. So that's where even this one will go. That is the ophthalmic division. Similarly, foramen rotundum. Rotundum means something which is right, round, something which is round. So that's where V2 will pass, maxillary division. And this is oval. Oval means oval, right? So this is foramen ovale. That's where this 3 will pass. That is the mandibular division. And it is this area, right? It is this area where there is that trigeminal ganglion. So everyone would be connected to it, right? So that's how things would proceed. So in order to see this, This time we'll not remove these nerves, right? We are back to orbit because what we are watching is the frontal nerve. That's the frontal nerve. And this frontal nerve is nothing but it is like a branch of ophthalmic division. And it will be giving branches, all those cutaneous branches, right? These are all cutaneous branches. They will go. And this one is the superior orbital fissure through which everyone was entering, right? So that's the superior orbital fissure. To see this thing with still better clarity, we are reorienting it, right? Not much, but slightly at an angle, right? This is where that's the anterior, right? No doubt about it. This is anterior, but this is the lateral wall, right? This is a lateral wall. So you got the idea. Previously we were just watching from the top. Now we just tilted the whole thing, or we bent ourselves so that we can watch the lateral wall, because on lateral wall this one is lacrimal, right? And this lacrimal now will supply lacrimal gland, right? So that's once again, right? It's now what we are discussing is all part of ophthalmic, right? Again, going back to our original orientation, right? So over here, right, this is nasociliary. Nasociliary. This one is superior oblique, right? That we have already seen, right? So this is nasociliary. This nasociliary now, again, it is from V1 only, right? To see what it is doing, we just push the muscle on one side. So we have pulled or pushed the superior oblique on one side. So this one was what? Frontal nerve, right? Frontal nerve. So from frontal, right, it is going, and then we are watching what this is the nasociliary. We are writing it in short, nasociliary, right? Nasociliary. We'll trace all of them. At this nasociliary, it is giving a branch over here. So that is what is called as the ethmoidal nerves, right? Quite similar, quite near to that area, right? And then this nerve, which is going up, which is going that deep, that is infratrochlear, right? This is infratrochlear. This is a cutaneous nerve, right? This is cutaneous. So here, that's now the picture is becoming slightly complicated, right? It was the trigeminal ophthalmic branch, and then ophthalmic division. Then from there to nasociliary. From nasociliary to one is going this ethmoidal nerve, and then another one is this infratrochlear nerve, right? And yes, from one side there was frontal nerve, and then there was lacrimal, right, which we have already cut in this, but then frontal was going like this, and on the lateral side that was lacrimal, right? This is just for the understanding, and this was frontal, right? And then the frontal was dividing and it is going into cutaneous. We'll see all of them. Okay. See the nasociliary, right? Now to be very proper, right? That's the nasociliary. See, it is going over there. It is giving branches, all fine, right? This nasociliary, it may give one or two branches, And these are like ciliary branches. This is long ciliary nerve, right? This is what is responsible for sensation to eyeball, right? So that is how there would be one more, right? One or two nerves they'll be going. Back to the drive. Now over here, which nerve are we talking about? We are talking about now branches of frontal nerve. And in frontal nerve, we said that yes, it will be giving cutaneous branches. Correct? That's what we said. So one of the branch, right? Now they are coming up, and one would travel and it would come out of here. So that would be supraorbital, right? This is supraorbital. Then there would be one more, and it will be winding around this. So that is what is called as the supratrochlear, right? This would be supratrochlear. And then there would be another one, and it would be emerging, and that is infratrochlear. So all these infratrochlear, supratrochlear, all of them, supplying, they will be supplying like all the way like this area, this area. Right? So that is the area which would be supplied by, right? Area by frontal nerve. Right? Because frontal nerve was giving those cutaneous, and these are the branches. These are what they are coming out. And that's how they really spread to the cutaneous region. We talked about one more branch, ethmoidal. You remember that? Right? That was the ethmoidal branch of nasociliary. That is what takes care of this. Right? That is handled by ethmoidal branch of nasociliary. Right? You remember that ethmoidal? The moment it was in, immediately one branch which was given behind. Yes, behind that superior oblique, right? So that is ethmoidal branch of nasociliary. It supplies this area. Okay, right? Now see this. From this point, right? Now when we are talking about maxillary and the mandibular part, right? That is this V2, V3. That's ideally 5-2, 5-3, but just it becomes easy. We need to see some of the bones very properly, because these are the bones which will be giving us complete idea about where exactly are these nerves going. So first thing first, we know this part. This is the lateral pterygoid plate, correct? This is lateral pterygoid plate. If that is lateral pterygoid plate, then just behind over here, that is none other but it is the back of maxilla, right? This is back of maxilla. And then there is space between maxilla and the lateral pterygoid plate. So this space is this one, right? That one is called as a fissure. And this fissure is between what? Pterygoid and the maxilla. So this is pterygo maxillary fissure. Fine. This is pterygomaxillary fissure. Now this pterygomaxillary fissure over here, what is this? What is this? This is inferior orbital fissure, right? So I'm just writing it over here. Inferior orbital fissure. Now from this angle, it looks like they both are separate. Right? They look like that they both are separate. Because on top of it, this is what? This area. This is nothing but greater wing of sphenoid. Greater wing sphenoid. And over here, this is back of maxilla. Right? If we just tilt it, right? If we just tilt it, we find this. Right? The pterygomaxillary fissure and inferior orbital fissure, they both are as such continuous. It is like they are arranged like this and like this. See, they both are continuous, right? This is pterygomaxillary fissure and this is inferior orbital fissure. Here it is. This is the perfect angle, right? Where we see that yes, it is continuous. Correct? Now to see this thing, let's see this thing from front. Here it is. So from front. So we are looking at the orbit, right? And this is inferior orbital fissure, right? As seen from the front. It is this area, this one. That is where the maxillary nerve will appear, right? Now this is, watch this, it is seen so clearly, right? So nicely. So that's like maxillary nerve appears here. But this is deep into the pterygomaxillary fissure. So when we try to see it from the lateral side, this disappears, right? Because it is not into one plane, it is deeply situated. So it is like right now we are in front, so that's why we are watching it, right? As such, this is deeply situated, deeply placed into the depth of pterygomaxillary fissure, right? We'll just see that thing into the dissection also. So here it is. See, as we move laterally, so this is lateral pterygoid plate, correct? Lateral pterygoid plate, and that's where, say, this is the maxilla, right? And then the pterygomaxillary fissure. So this is where the maxillary would be taking place, and this is behind. This is where the mandibular will come up. This is for the mandibular. So we write V3, right? This was for V2. Perfect, right? So mandibular nerve will be emerging here, and when the mandibular will come, it is like an express highway, right? So let's see these structures properly, right? Because then and then the beauty is into this dissection. So first thing first, we remove this big muscle, right? This would be a sort of revision. Everything we are removing layer by layer. So this is the masseter, that bulldog muscle, and let's remove this, right? So we remove this and done, right? Removed. Next muscle which we need to remove, that is, see, we watch over here that there is so much of fat, right? Which fat it is this? It is deep temporal fascia, right? So let's remove this fascia. Once we remove this fascia, then this is pretty clean, right? But in order to see, we need to sacrifice this zygomatic arch, removed, right? So zygomatic arch gone. So when you know this part, that zygomatic arch, that temporal face, that fossa that is filled up by temporalis muscle. So this is a big temporalis muscle. Let's remove that. because we really want to go into the deep depth of this structure. So temporalis muscle gone, right? So this temporal is gone, and now we have started watching something, but this mandible is coming into picture. Let's remove, right? That's a ramus. This is the coronoid process. So everything, ramus, coronoid process of mandible, right? We'll call it back when needed. Right now, let's remove it. So even that has been removed. And now when we remove it, we start watching the nerves, right? But still, see the nerves, right? They are there, right? See the nerves, they have started appearing, but still it is hidden behind someone, right? There is one muscle over here. This muscle is lateral pterygoid muscle, right? Lateral pterygoid. So let's remove that also, right? And along with that, we even remove that condyle, right? So even the mandible is also removed, this portion. And as soon as we remove, now see the nerves, they have started appearing. Every nerve is seen so beautifully. So basically what we are watching is infratemporal fossa, right? We are watching is infratemporal fossa. Now, our purpose was to watch for first the maxillary part, right? So let's orient ourselves. What we saw in the bone, let's identify things over here first so that it becomes easy that what exactly are we looking at. First thing first, back of maxilla. Yes, it is this, right? This is back of maxilla. That is back of maxilla. So if that is back of maxilla, and we just cut the lateral pterygoid plate and lateral pterygoid muscle. Lateral pterygoid muscle was connected to lateral pterygoid plate. So this must be the plate. This is the plate. That's right. So that is lateral pterygoid plate. So between lateral pterygoid plate and the back of maxilla, we do have this space, right? We do have this space. So that space, right? That space, this space, right? That would be pterygomaxillary fissure, correct? So we write it over here, and then we just draw this like this so that we know. So this is pterygomaxillary fissure, because everything will be revolving around him. And in pterygomaxillary fissure, up portion, that would be the greater wing of sphenoid and everything. Now zoom this, right? Because we are watching some nerves over here. So let's zoom this. Right? Watching it. In this, say lateral, that pterygomaxillary fissure is what we said, but it is in continuation with what? Inferior orbital fissure, right? So that is how it is going. So that's the fissure which we were talking about, right? This is pterygomaxillary and this is inferior orbital. See the thing, how things, they look so different, right? When we really watch it in real dissection, right? And when we remove lateral pterygoid muscle, which is the muscle which is medial to it, medial pterygoid, that muscle is over here. Here is that muscle, medial pterygoid muscle, right? And see, these are the mandibular divisions branches, right? So they are landing on that medial pterygoid muscle. So that's how, so they'll come into picture. So see how the bigger branches, and then they'll be connected to chorda tympani and everything. We'll see that, right? So this is also one very interesting portion. And this one is what? That one is buccinator, right? That one is buccinator, correct? So here pterygomaxillary fissure, and it is continuing as inferior orbital fissure, right? Now we watch this part, and that is maxillary, right? V2. So this is that ganglion, right? Just for the reference. And we move further. It will come out via rotundum. Some things I'm repeating because you remember it for long, right? Rotundum is round. R for R. Shape is also round. When we'll draw oval, we'll actually draw it oval. Okay. So this is the place. This one, right? That is what is hidden in pterygomaxillary fissure. Right? So this is like our front view, right? Front view. And maxillary, that is V2, is going to come out of that rotundum. We'll be able to see it from here, right? We'll be able to see it from here. So let's, when we try to see it from lateral side, as we said, that yes, we just can't see it, right? Because it is where it is into the depth of this pterygomaxillary fissure. So back to that image, right? And it is this one. That is the V2 or the maxillary. That's the maxillary now, the V2. So let's zoom this because this is the area to watch. And we have zoomed it nicely, right? So this is V2, right? Or the maxillary now. So this is running across pterygomaxillary fissure, right? So this is pterygomaxillary fissure. And then over here, it is like inferior orbital fissure, right? So this nerve is continuing as, right? So I'm now just erasing this so that we can see those nerves properly. So here, this is continuing as infraorbital nerve. Remember this infraorbital nerve, that is nothing but just the continuation of maxillary nerve. So this is like big, right? Big to big, straight away it is going like this, say like this, like this, like this, and just giving one branch over here, right? But otherwise it is main which is going. This is a branch. We'll talk about this branch, but that is infraorbital nerve, right? Straight away it is going. Clear? It is emerging from rotundum, right? Remember that it is emerging from rotundum. Now we change the perspective. Now for the next 15-20 minutes, right, you are going to be bombarded with so many nerves because that's the area where people would fumble. This is where you have to gain, you have to get the upper edge, right? Otherwise basic to optic, olfactory, everyone knows, right? Those 3, 4 and 6 also everyone knows. So here start generating that entire, and whenever we talk about any nerves, try to recollect it that okay, it was from trigeminal ganglion, then to rotundum to maxillary nerve, it is continuing as, right, infraorbital nerve. And that infraorbital nerve, it runs in the bony tunnel, right? It runs in the bone. Now onwards, all the nerves, most of them, they will be running into strange bony tunnels. So at times when possible, we'll chip off the bone and we'll try to see that, okay, nerve is running over there, right? Otherwise we'll really draw. Okay. So it was going towards inferior orbital fissure. So we are talking about infraorbital, right? Infraorbital nerve. That infraorbital nerve is coming over here, right? But then, just a minute, slight change in the angle. We just draw it like this, but it is into the tunnel. It goes below and it comes out. It comes out, right? This is infraorbital now, right? In bony tunnel, it creates a tunnel, and in that it travels, and it comes out of this foramen. So that's why name of this foramen is infraorbital foramen. Now over here, now starts the work of this infraorbital now. It gives three branches, right? It supplies one, it goes above. Oh, let's take this red color. It goes above. Palpebral. It goes towards nasal. So that is nasal. It goes towards lips. So it is called as labial. So here now we have got the palpebral, nasal, and labial. Right? These are the branches. So what they really do, collectively, they supply the cheek, they supply the lateral wall of nose, right? The external nose, and the upper lip. That is what is supplied. Right? Now there are few more branches. It is not so that it stops at this point. Maxillary we are talking about, right? V2 we are talking about, a big second division. This second division will also supply upper teeth, nasal cavity, palate, right? All these things. So when it is supplying palate, when it is supplying nasal cavity, right? When it is supplying upper teeth, right? Now all these things, they are deeply situated. So it means there would be nerves, but all those nerves, they'll be running into bony tunnels, right? So let's see that, right? How exactly they really reach to that. First, we go back to our dissection, right? So we have separated, we have cleaned up some area. And this is V2, right? Which is continuing as infraorbital, right? Infraorbital. At that point, we just ignored that who is this, right? So all these, right? These are going down. These are posterior, superior, alveolar nerves. And as per our plan, when we say posterior superior alveolar nerves, that means there must be something like posterior, even the anterior superior alveolar nerves. Yes, they would be. They will come. Right? Now what they do, they go down. They go down. Right? And they would run into the tunnels in maxilla. So this is maxilla, right? That is maxilla, because over here this was pterygomaxillary fissure, correct? That's like say that is inferior orbital fissure. Then on the top there was sphenoid, right? So they run in maxillary tunnels. Maxillary tunnels. From maxillary tunnels, where should they really go? We once again come out, right? That is what really happens to that branch. So one is that we saw it over here, right? That infraorbital is there, right? And what infraorbital was doing, right? Infraorbital was right now we'll draw it a bit dark, right? And it was coming out, and then it was giving all those branches, palpebral, nasal, labial, etc. But within the tunnel, this is a tunnel, right? So I'm putting it like this. This is a tunnel. In that tunnel, there is emergence of one branch, right? Say how interesting. In the tunnel, it gives one branch. And that branch is, you must have, yes, this is anterior superior alveolar nerve. So that was, this one was posterior superior alveolar nerves, right? These, right? And they will be running into maxillary tunnels, right? Maxilla is upper jaw, right? And over here through the floor of the orbit and then coming out, and then anterior superior alveolar nerves, they are running, right? The idea is when we see this thing over here, from here, right? From here, it is anterior superior alveolar nerve is coming. From here, those running into tunnels, and see, this is not happening on the surface. This is happening into the tunnels, underneath the bones, right? Into the tunnels. They form the loop. This is the best part, right? They form the loop. So this loop, which is formed within the bony tunnels by anterior superior alveolar nerve and posterior superior alveolar nerve, correct? Posterior superior alveolar nerve, and they form that loop. Why the loop should be formed? See what a craftsmanship. From this, tuck, 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 tuck. These are dental and gingival branches. So they give upper teeth and upper gums, right? So all these are dental and gingival, right? Dental is for teeth and gingival is for gums. So then gingival branches, they arise, and that is what is given to upper teeth and gums. Beautiful, right? This is how they end up. Now see, we saw V2. In that we talked about that it also supplies this palatine, right? And nasopalatine. So when it is doing this palatine and nasopalatine, that means palatine will be going towards palate, and nasopalatine, as it is said, that it will be part of the nasal cavity and the palate also, right? Nasal cavity mostly. So this means that we need to talk about these, that how are they distributed. In order to see this thing, we are now dividing the skull, right? So this is into sagittal plane. We just cut it, and then we watch it from the median side. Here it is. You need to imagine, you need to visualize very nicely now. This is the medial view. Nasal, palate, everything is seen. We watch for that sphenopalatine foramen between sphenoid bone and the palate, right? So here it is what this is, sphenoidal sinus, right? That is, which is very nicely known to us, sphenoidal sinus. Then this one is the pituitary, right? Pituitary fossa and dorsum sella, etc., right? It is this portion, that portion, that is what is sphenopalatine foramen, right? That is sphenopalatine foramen, which is opening into the pterygomaxillary fissure, right? It has to open in pterygomaxillary fissure because then and then, because maxillary to was coming from there only, right? Maxillary was coming. So now it will send few branches at this point. So let's take a zoomed version. So this is where we zoom, right? So here it is, here it is. This is the foramen, right? And that's the emergence of that V2. right? And into the bony canal, right? It will send those branches, right? They will go all the way and they will supply the palate. Similarly, there will be one more, and this one is smaller, right? Something which is, so they both are called as palatine branches. This one is greater, this one is lesser. So greater palatine branch and lesser palatine branch, remember they will be traveling into the canal, into the bony canal, right? Into the bone. Now over here, right, because it is passing into the bones, into the canals, right? Where they emerge, right? See, this is where they emerge. Let's say, let's over here, right? What I'm trying to show is this area, right? So if we watch the skull from here, right? So that's how we see, right? That's how we see. That's the hard palate, and over here, that's where those, they go like this, they go like this, right? That's where they appear. So this one is palatine foramen. That is palatine foramen. And over here, this is greater palatine. And this one is lesser palatine. Obviously, nerves, right? So traveling into the bones and then emerging from the specific foramen. Still, it's not over, right? Now what we are watching is, this is the nasal cavity, right? In nasal cavity, what we are watching, we have studied nasal cavity, and just from the concha, immediately we say that this is the lateral wall, right? This is the lateral wall. So from lateral wall, right, we just said that yes, those greater palatine nerves and lesser palatine nerve will be passing into this bony canal, right? And then they will be appearing over here, right? During that path, they'll be giving few branches, right? They'll be giving few branches, and these branches are like nasal branches. So these are the nasal branches of greater palatine nerves, which are branch of V2, right? For the understanding, we are telling V2, right? Other the second part of the trigeminal. Okay. So this is the greater palatine, right? That is what will give sensation to palate, hard palate, right? That is what is it is giving. That is the palatine. Now there is one more thing. As the main nerve is going up, right? It is already traveling, right? That trunk, that V2. So V2 sends one direct branch, right? So V2 is already, let's change color, right? V2 is already there. So it sends one direct branch, and this is also for the nasal. So this nasal is the direct branch from V2 trunk. This one. And collectively, they take care of the lateral wall of the nasal cavity, right? So that is how this is formed. Now, nasopalatine foramen, right? Nasopalatine. See, going back to this, we just talked about this. Now is the time to talk about nasopalatine, right? Because what we said, that this Second part of trigeminal, it not only supplies all those what we saw above, but it also gives this palatine and nasopalatine. And nasopalatine and this palatine, these are very delicate small nerves, and they pass through the bony tunnels. So that's why their dissection is difficult. Nerves are extremely thin. So that's why we are trying to understand it by drawing the lines. Whenever possible, we'll even see that, right? So over here, over here, by the end of today's session, you will realize that you have watched more than 100 figures. Okay, so here it is, right? This one, right? Between, so that is nasopalatine, foramen, right? And then this is what? This is sphenoidal sinus, right? Perfect. So over here, that's the nerve arises. So that is nasopalatine nerve, right? Nasopalatine nerve. What that nerve will be doing. Now see, you saw the lateral wall, right? Now this is the nasal septum, right? This is, remember, this is nasal septum. That means we are talking about the medial component, correct? So that's where the nasopalatine nerve will come into picture. This nasal septum is supplied by nasopalatine, right? Nasopalatine nerve. So these are like a sort of keywords. So same thing over there, right? That now when it goes and it gives branches, right? And that's how it supplies. It would also be passing via incisive foramen and on to the hard palate, right? So it goes for that anterior part of hard palate. This V2 is so powerful, right? You'll say we are step by step, we are keeping on adding more and more nerves, right? This is same that inferior orbital fissure, right? It will give zygomatic branch. So that's the zygomatic branch. This is zygomatic branch or zygomatic trunk. And then it divides into two, right? One which goes above. So that is what is called as the zygomatico temporal. And one which is over here, it is what is called as the zygomatico facial. Right? Both of them, right, they supply to the side of the face. Right? So that is how the zygomatico. What is that foramen for anterior part of hard palate? Okay, that is incisive foramen. Right? That is incisive foramen. So that's how V2 spreads, right? Now we go for the third one. This is V3 or the mandibular. Now mandibular is even barb of maxilla. Right? So that's the trigeminal ganglion and this is the mandibular, right? Mandibular, this is V3. and it will be passing through foramen ovale, right? So that's the foramen ovale. This foramen ovale, when it will try to come out, so that's where it tries to come out, right? And just for the orientation, yes, it is very easy. This is the lateral pterygoid plate, right? Lateral pterygoid plate. So till this point, we were dealing with pterygo maxillary fissure, which was over here, right? Anterior to lateral pterygoid plate. Now we are dealing with this foramen ovale, which is opening just behind lateral pterygoid plate, right? So that's the key word, that ovale is behind lateral pterygoid plate. Fair enough? Okay. And here comes the beautiful empire of mandibular, right? This is mandibular V3. Now see, so many nerves, right? So many, all of these, and every nerve is important. So first, we pick up, because we said that this is as it is emerging from ovale, right? This is emerging from ovale. So it would be supplying over here to pterygoids, right? It will be supplying few muscles, right? See over here, it will be giving these branches, right, to masseter, right? Then it will be giving branch to temporalis. All these are nothing but basically, so they are the muscles of mastication, right? So it is like motor by supplying muscles of mastication, right? Chewing, mastication. Plus, there'll be two, they are not seen over here, right? Very properly. This is one, and then there is, it has gone behind. There are two. These are the nerves to tensor tympani, muscle to those tensors. So tensor tympani and tensor palati tensor palati. So these are supplied by them. We watch for, so right, so that is how it goes. Now two important nerves, now we are changing the color. These are sensory, right? So first one, such a big one, which is going over here, big one, right? This is taking sensation to the side of the head, right? And that is what is called as the auriculotemporal nerve, right? See, the name is pretty easy, auricle temporal. So that's where it supplies, right? Auriculotemporal nerve. This big one, right, which is going all the way, this one, this big one, that is buccal nerve, right? Again, this is sensory, right? And it is exactly on the cheek, exactly on the cheek, right? So it means if someone slaps me, right, so then that is the area, right? That is the best way to remember, right? So it is on cheek. We say that thing as slap area, right? So that is where it supplies. Still there are big nerves over here, right? So for that we need to work on it. So what we do, we cut something, right? Or you can use this thing as practice, because we want to see the lower area, right? So you can use this thing as a practice. This is zoomed one. Now these are the two major branches which we'll now see, this one and this one. They are lying on one muscle. Lateral pterygoid, so we have already sacrificed, and this is the next muscle. So this is the medial pterygoid, which we are watching, right? This is medial pterygoid muscle. And to this and this. This one, right? This is what is called as the inferior alveolar. We saw that superior alveolar, right? Posterior superior and anterior superior. Now comes the inferior alveolar, right? And this one, second one is the lingual. They both are super duper nerves, right? Very, very fine nerves. The way they will go, that is so smart. To see that thing, right? Because we cannot really dissect it. We have to really imagine that where it will be going. So first, what we do is, so this lingual to will trace all the way, right? So that's where the lingual is going to travel. So that one would be the lingual. But this inferior alveolar is very interesting. What inferior alveolar will do, it will enter into this foramen, this, right? And over here, this projection, right? That is lingula. So that projection is lingula, right? And this now will be passing into that foramen, and then it will travel into the tract, right? Into the duct. This is the area. This is the area. That is where the medial pterygoid muscle is attached, right? Okay, so that inferior alveolar over here, this one is inferior alveolar, and this one is lingular, right? Lingular, lingual. Now take lingual now, and that is inferior alveolar now. That's what we watch over here. That inferior alveolar is this one, right? Now we focus only on this inferior alveolar now. It goes into the mandible. Yes, here it is going into the mandible, and this projection, what we are watching, that is lingula, correct? That lingula was the projection, inside projection. And then which muscle was immediately over there? Here it is. Which muscle is this? This is medial pterygoid. Now picture is very clear, right? That's the medial pterygoid muscle. So that's how it goes, and it travels into the mandible. Remember, right? It is into the mandible, into the mandible. So that's where, right? So here it is. Here is the nerve. Here is the nerve, right? Inferior alveolar, right? That's mandibular foramen. And this mandibular foramen, it will lead to that canal, right, in which it will travel. That's the lingula, the projection. This is how it travels, right? To see that, so we chipped off the outer layer of the mandible to see that this is how it is traveling. This is that duct. This is that duct which is created, right? Not only that, we were lucky to see one more now over here, right? See the branch which is just emerging from the top. That is the mylohyoid branch. This is the mylohyoid branch, right? And this would be supplying to mylohyoid muscle, right? Mylohyoid muscle. Plus, there'll be one more, right? The digastric, right? So anterior belly, digastric. Right? That small now, what we are watching. Meantime, this bigger one, inferior alveolar, that is continuing its journey. So that is inferior alveolar. That is continuing all the way into the mandibular canal. And it would come out, right? See, all the way, right? It is getting pierced, and finally it will be coming out via what's called as the mental foramen. Mental foramen. That's where it comes out. And when it comes out, it is called as the mental nerve, right? It is called as the mental nerve. And it is this mental nerve which supplies the lower lip and the chin, right? Chin and the lower lip. So chin plus lower lip. So that's how it really goes. Now, not only that, we see some few more other nerves. It's small nerves which are going over here, small nerves which are going over here. So they will be going for lower teeth and gums, right? So over here they are for lower teeth and gums. Fair enough. The next one is this one, lingual, right? Now, in order to see this lingual now, we need to destroy almost all these structures, right? So we cut even the inferior alveolar now, right? This is the inferior alveolar, right? So we'll remove that. We'll remove large amount of this mandible also, so that things, they can be clearly traced all the way down. So that's what we do, right? So we cut those nerves, right? The mandible is removed, and this one is lingual. Now, when the lingual nerve is traced all the way till the end, right? So out of enthusiasm, we go back, right? We go back. That do we find something of good over there? And we find this, a small nerve over here, right? A small nerve. This is absolutely at the top, right? This is what is called as the chorda tympani. Right? Just in a minute, we'll be talking about that also. But till that point, just remember, this is a special branch of facial nerve, right? So I'll just write down, this is a special branch of facial nerve. Facial nerve. So that is called a tympani. Now we continue, right? So that's the lingual, and it goes down. Let's trace it down. So here it is. It reaches at the lower level, right? It comes down, and then there is this medial pterygoid muscle, right? Medial pterygoid muscle, and it continues till all the way to the base of the tongue, right? To the base of the tongue. And in order to see this thing, what we have done, we have removed the mandible. At the same time, we have removed the mucous membrane of the tongue, of the oral mucosa. All those things, they have been removed. Some things have been dissected so that we can really actually see all the way up to the end, the lingual nerve. What it will be doing is, this is really very important, because it is this nerve which will be carrying common sensation, right, of plus taste sensation to anterior two-third of the tongue, right? Anterior two-third of tongue. But what we were interested in was this taste. That these taste fibers, right, taste sensations, they are carried by, here so it is okay, right? But all those fibers, they will be actually carried to that chorda tympani, right? That's the importance of that now. We'll be talking about it much when we'll be talking about facial, right? Because it is branch of it. So that's how, say, it really moves. So this was cranial 1 to 6, right? Tomorrow we'll be talking about 7 to 12. So pretty long session, right? So thank you so much. You might need 1 or 2 times revision, but be prepared, because next 6 nerves, trust me, they are relatively easy, right? There will be branches, but this trigeminal was the trickiest. Once you have understood trigeminal, then none of the other nerve would be as tricky as trigeminal, right? So the file has been saved and we're putting into shared folder. Thank you, good night, and bye bye. See you tomorrow for 7 to 12. Bye bye.